So part of it is, well, what stage are you at with your information? What types of information and processes do you have? Can we improve these processes to make them more appropriate for an electronic document management system? So improving what you've essentially got already. And the first step that you can take is to assist that forward scanning process, reworking the forms that you have already. So for example, here we have a form, but what we've done is added a barcode, 2D barcode top left. It means that this form can be bespoke. We can include demographic details for the patient automatically printed onto the form. The addition of the 2D barcode means that as soon as this hits the scanner, there is no additional preparation that needs to be taken care of. As soon as it hits the scanner, we know that it is a form for Jane Smith for her encounter with Maria O'Neill on a certain ward on a certain date. Now, you can have Evolve generate up completely bespoke forms, or you can actually take your existing form and maybe go to your medical illustration team and say, okay guys, please add a barcode to this form so that the form is identifying itself as being a blood monitoring request form or whatever. And the idea is that when you're with the patient, you then add a sticky barcode, a barcode label onto the form. And so we've got the two barcodes in play. We've got a barcode that says this is a blood monitoring request, and we've got a barcode that says it's for this patient as part of this particular episode of care, etc. And this idea of barcoding means that there's minimal disruption to, for example, the clinics. Your clinicians work with the forms that they are already used to working with. It just helps the forward scanning process. It removes the requirement for a lot of preparation. It's just popped straight onto the scanner, and automatic indexing then can take place at the point of scanning and placing it into the system. And so that's a good starting point. It's reusing the forms that you have and the work processes that you have. Taking that forward then, we're moving into the realms of fully electronic forms. And these can be controlled by workflow. A good point of reference would be the map of medicine. So it has a workflow it's a workflow path. So for example, for venous thromboembolitis risk assessment form, it has a path saying, is the patient over a certain age, then treat them in a certain way, etc. And so here we have Evolve, and I've got a menu here for my various forms. And so I've selected then a VTE risk assessment. And so what the trust has done is they have then created up, or they can use one of the pre-canned forms that ship with Evolve, a form that is completed completely online. Now notice that we will partially pre-complete the form with various fields that we get maybe from the PAS, etc. And the idea is that the user then simply works down through the form, filling in the various fields. And that can then be used to kick off a workflow process. An example would be if it was a discharge form, and we said at the bottom of that discharge form, this patient needs transportation home. That could actually kick off a workflow to the non-emergency transportation team saying, right, please arrange transport for this patient. They're going to this particular location. If we have a form that does require what we call a wet signature, so for a patient to actually sign it, what we can do is actually print out the form with a barcode, and it means that the workflow process essentially pauses while we get the patient to sign the form. When that form is then scanned in, that barcode allows us to link that physical form up with the process that's currently being paused online, and it starts that process off from the place at which it was paused. So you can actually have a hybrid online, offline process for the completion of forms, for example. One of the key and unique points about Evolve is that Evolve ships with designers that you can actually start creating your own forms with. And so what we always say is these forms are best designed by the people who are going to use them. You know, we always have the phrase, by the trust, for the trust, and we firmly believe that. And so Kinos, with the Evolve product, does a lot of knowledge transfer, knowledge and skills transfer. So we will help you, we'll maybe sit with you to design the first form, and then you'll design the second form with us watching, and after that you're much more self-sufficient. It means that you don't have to come back to us every time you want a small change made or a new form made. A trust then becomes a lot more self-sufficient as to how they drive their business processes forward in the future. And really it can become a very iterative process. So the idea is at the start, identify the process that you want to update. Have a look at using the designer tools to create the various forms for that process, and also create the workflow process using the workflow process designer that ships with Evolve. Review that within a clinical setting, and this is where we always say that clinical engagement, as Sarah was saying with communication and involvement, clinical engagement is absolutely key to the implementation of an EDM project. Having a group of early adopters, if you like, or champion clinical users makes a massive difference. So these are the guys that are giving you feedback, telling you what's working, what's not working, and then encouraging the other users to actually get involved with the system as well, so they become your champion users. So the idea is identify the process with these guys, model it up, review it, and then you can refine it. It allows the trust to identify quick wins and to really start moving the process forward, the overall change management process, and it becomes very iterative and very straightforward, essentially. So let's talk about some numbers. So the sample case for an ADM that we had with one of our trusts. So the figures that they provided, they had 500,000 records on site in their records library. They had 120,000 of those stored off-site, and they had various other departments within the organization that had records within them. And the predicted growth of new records per year was around 8,000. So 8,000 new folders actually being created within that trust on a yearly basis. 70 records called from off-site storage per week as well. And here's how it looked. And so really the big figures are the actual shuffling around and moving of paper, 1.68 million per year at £3.50 per movement of a file, 18,000 for an off-site request, 70 per week at a £5 request, giving a total of around 1.8 million pounds per year just spent on managing and moving and storing paper, with an expected growth of £126,000 per year. And so you can see that the numbers very quickly stack up. If we can start removing paper physically from storage by scanning it in and removing it from the organization, cutting down on the amount of effort, time, staff required for the actual physical shifting of that paper from clinics into elective surgery wards, etc., you can start very quickly cutting down on those sorts of numbers. And so you get a very quick return on investment with a solution such as Kainos Evolve. The items that weren't identified as part of this business case, but in turn add to the business case, was the time spent and the cost of actually weeding those records. So people haven't been seen in 8 years. It's now time to remove their records, or at the very least check if we need to keep it for a longer period of time. So usually the employment of summer casual workers going through that library and identifying anything that should be destroyed or should be kept for a further amount of time. The actual cost of more subject access request responses and Freedom of Information Act responses. Once information is online and easily searchable and easily flaggable in terms of is this disclosable or is it not, that process becomes a lot quicker to actually manage. And it didn't take into account the fact that coding then, we're not waiting for a file to be sent to them before they could start coding. Because all of the information is online, at any point within the actual patient care process, the coding team can be starting to do what they do the coding. And at that point, during the business case, the trust was actually undergoing a review of the coding deadlines, so it wasn't included. But again, these are simply areas that make that business case stronger. They bring a even quicker return on investment for the actual implementation. So now that we've talked about what ADM is, well, how do we actually take it forward? And how do we derive further benefit? And really one of the big challenges is, yes, a solution like Evolve, an ADM solution, will bring you a reduction in cost in terms of library resources. But the challenge with all of these things is, well, can a trust actually turn reduced library resource demand into real savings. So, for example, will they actually redeploy into the scanning bureau, followed by headcount reduction? Can they make better use of portering staff or reduce headcount there? The fact that you can easily find records now, there have been various statistics over the past year around the amount of time that nursing and ward clerk staff and medical secretaries actually spend just trying to find patient records. So the fact that they're now available instantly online, can we actually reduce or can we produce savings from that? Can we redeploy those people and make better use of their time? And also we have to bear in mind that there will be an altered job role. So can we, again, make better use of people's time? There are new opportunities to be realized as well. So the idea that acute trusts are now being asked to deliver community services. Well, historically, those community services will have had paper-based folders of their own. But the idea is that by using a key identifier like the NHS number for a patient, we can then start to tie up all of those medical records together so that we can, as soon as we scan it, that information from the community record is automatically merged with the record that the hospital already has about that patient. And so we're getting further aggregation of the patient information into one source with minimal effort. You then have one single repository for both clinical and corporate unstructured data. So it's worth bearing in mind that when you purchase Evolve, you also get a license that will handle both the clinical and the corporate, so human resources, finance, HR data, all within the one solution. And because you now have all of your information within the one solution, you can start to make better use of that information. So instead of it just being legacy, essentially dead information lying in a paper file, you can start doing data mining. So for example, looking at doing research projects, comorbidities, for example, pattern analysis. So if a patient presents with this particular symptom, here's also other symptoms that other patients have presented with, because we can start doing appropriate data mining of that information as well. So just to summarize, we are not starting a war against paper. Paper is still a good way of capturing information in some processes. But what we would always say is, where possible, let's make that paper work better for us. Let's make it intelligent by adding the barcodes so the paper becomes a capture mechanism, but as soon as possible we can upload it with minimal effort into the system and make it much more usable in an online fashion. And where we possibly can, let's start replacing paper by producing electronic forms that are controlled by the trust, that are managed and modified by the trust. And what we say, just to come back to that central point, is that for organizations with an electronic patient record, if you want to get maximum benefit out of that information and get a holistic view of the patient, then you must take paper into account and take the paper processes. And the use of an EPR alongside Evolve, where Evolve is managing what would historically have been in paper format, means that you've got a one-stop shop for all of the information about that patient. And more information means better care, means more safe care, because you're aware of a much greater picture about that particular patient and about their care. So if we just take a final quick poll, now that we've talked about various areas of Evolve, just want to gauge where people's interests lie. Is it in-house scanning, or is it presentation of documents to the users? Is it the electronic forms, the workflow, or the fact that we're beginning to aggregate all of the information about that patient into one source? Okay, so we close that poll. Let's have a look at the results.